If you would like to document in your chart note when the patient should return and for what reason, you can add a recall. Click the Recall/Physician Reminder Template tool to do so. Then, from the top section labeled Recall List, click New. Start by clicking the lookup icon for Recall Type to search for a reason for this visit. Highlight the applicable reason and click OK, or just double-click on the option and that will select it as well. Then enter the date of the recall. This is the date that the patient should return to your office. You can either type the date in the applicable box, click on the calendar to select a date, or use one of the shortcut keys to quickly select when the patient should return. Recall type and date are the only two fields that are required when entering a recall. So at this point, if you have added those two things and feel that you do not need to document any additional information, click OK to save your changes, or click Add Another if you'd like to add another recall. If you would like to pre-populate some of the recall information, you can attach a provider and/or a procedure to this recall by clicking the applicable lookup icon next to that field. If you would like the recall to be displayed on the face sheet, then check Show on Clinical Face Sheet. This checkbox will not be selected by default in Practice Manager. So if you are entering a recall through Practice Manager and want to see it on the patient's face sheet in Clinical, remember to check this box. The Fulfilled checkbox designates that this recall has been completed. Typically, you would not select this while creating the recall, but instead later when it has actually been fulfilled. Lastly, you have the option to document the reminder method that was used for this recall. The reminder method is how you reminded the patient, either by phone or by mail. This, again, most likely is not something you would do at the time of creating the recall, but later when you actually do send out a reminder or call the patient. Once you are done adding or editing this recall, click OK to save your changes. You will then be taken back to the Recall Management dialog, where you could either add another recall by clicking New, or edit or delete a recall that is currently in the list. When you are done managing your recalls, click OK to close the dialog. You will then see the recall information populate your current chart note, as well as the face sheet if you have the option to display that information turned on. Please keep in mind that this was demoed through a chart note in Clinical. However, the functionality is exactly the same if you are entering a recall through Practice Manager. Outside of a patient's chart, on your to-do list, you will see a reminder notification for recalls and physician reminders under the Recall tab. If you are not seeing a particular recall in your list, make sure you have your cutoff configuration set far enough in the future. For instance, the date of the recall we just entered was 2/1/17, so I will need to go to Recall, Cutoff Date, and then change the date to far enough in the future. After I click OK, I will then see the recall I entered for next year in this list. Clinical will remember your cutoff setting, so you won't need to adjust it too often. If you double-click on the recall reminder from your to-do list, it will open the patient's chart to the note in which you entered this recall information. Lastly, in order to stay on top of your recalls, we have the option to prompt as to whether any recalls were fulfilled at this visit when you open a new note. In order to see this dialog, you will need to turn on the preference. To do so, go to Edit, and then Preferences. On the General tab, there is an option for Display Unfulfilled Recalls when chart note is created. Check this box if you would like to be reminded about unfulfilled recalls when opening a new chart note for a particular patient.